In the new episode of COVID Chronicles, we will tell you when mass vaccination against coronavirus will start in Kazakhstan. We plan to vaccinate about 10 million people. How did the capital's ambulance service work during the peak of the pandemic, and what were the doctors most afraid of? We had queues, we couldn't accept patients, there was panic, no need to hide it. What is the situation with coronavirus in the land of the morning freshness? Why do they impose strict quarantine measures in South Korea's capital? People not wearing face masks will face fines of 100,000 won. At the end of February 2021, mass vaccination against coronavirus infection will start in Kazakhstan. This will happen after the Russian vaccine Sputnik V passes the necessary tests. Earlier, Kazakhstan's single drug distributor SK Pharmacy and the Russian Direct Investment Fund agreed on the delivery of 2 million Sputnik V vaccines. It will be produced at the Karaganda pharmaceutical complex in stages. The first 80,000 doses are expected in February, 150,000 doses will be ready in March, and then 600,000 doses will be available every month. The first to be vaccinated will be the most susceptible groups, including doctors, teachers, and law enforcement officials.
То есть 2 миллиона доз гарантированно. Дальше у нас ведутся сейчас переговоры по дальнейшим поставкам, пока 2 миллиона доз.
It means 2 million doses are guaranteed. Now we're negotiating on further deliveries. 2 million doses have been agreed upon so far. In total, we plan to vaccinate about 10 million people, or 55%. We have determined the major vulnerable groups of the population who have direct contact with the sick. So far, the group includes people aged 18 to 60. The instructions for use of the Russian vaccine, which we have on hand, state the age from 18 to 60. Now, the data on the final stages of the tests are already being disclosed. If the age range is extended, we may increase the number of vaccination participants respectively. According to Alexei Tsoi, Minister of Health, the domestic vaccine being developed at the plant in Jambul region is expected to appear on the market in mid-spring. Meanwhile, according to the latest data in Kazakhstan, the number of patients with coronavirus has exceeded 162,000 people. I remember that time very well. Although I am an adult, a doctor, when I first heard it on TV, I thought that it wouldn't affect us. But when it came to life in Nur Sultan, I'm not talking about other Kazakhstan cities, there was fear. We were afraid of what kind of disease it was, what kind of virus it was, because we were not ready for it. No one was ready for it. Not only the people, but also the doctors were not ready. If doctors had been ready, probably there wouldn't have been such a rush at the beginning. Ambulances were bringing patients to hospitals and we had queues. We couldn't accept patients. There was panic, no need to hide it.
А у нас когда очереди стояли, больных не принимали пациентов. Была паника, что там скрывать.
The longest shift was 24 hours. It was when the replacement had to take the shift, but he got sick with COVID and we had to help him. We worked 24 hours hoping just not to get sick. 2020 was a very difficult year. No one expected such a pandemic. For us, it was a lesson to support each other, to comply with the infection control requirements, hygiene requirements, and to wear masks. In previous years, we just studied a biohazard suit used for especially dangerous infections, how to put it on, how to take it off. Then, we had to put it on every day. At our substation Almaty, we accepted more than 20 patients. When we told our young doctors and medical assistants that we were going to a COVID-positive patient, many staff were afraid, the young ones were afraid, the drivers were afraid. We thought that if we got infected, who would feed our family? I cannot say that I was not afraid. I was afraid. But since I chose this profession, the fear was secondary. If I were afraid, although being so experienced, I would set a bad example for the young.
Раз я выбрала эту профессию, чувство страха, оно уходило на второе место. Значит, если я буду бояться, вот такая опытная, что я буду, какой пример молодым показывать?
Have you been to a bathhouse? Have you felt the steam? It's like being in steam. It's hard to talk, you have to speak loudly. You are in a biohazard suit, the glasses sweat, you can't see anything. When you take off the biohazard suit, there is a trail of sweat under glasses. After the sanitary treatment of the ambulance, you put on the suit again. When you come home, you're tired. It was unbearable to wear the biohazard suit from morning till evening. Especially in summer, when it's hot, you put it on and you feel as if you just left a bathhouse which was full of steam. You feel weak, tired, so you come home and fall on a bed.
Вначале вообще город, стационары были не подготовлены. Это же потом же подготовили.
In the beginning, the hospitals were not prepared. Later, they prepared hotels and patient hospitals. We were losing time while admitting patients to hospitals. We missed other calls. That's why sometimes people couldn't reach the ambulance. People were calling with any problem. They were in fear and they called 103 to get advice on everything. Of course, the line was always busy. There were calls of the first, second, and third urgency levels. There were delays because our medical teams could not accommodate patients in hospitals. We heard about this problem from the people. I don't know if the people would believe it or not, but we tried to do our best. The mobile teams and the administration did everything that we had to do.
Но я не знаю, поверит в это население или не поверит. Мы старались. Выездные бригады, в том числе вот мы, администрация. Что от нас зависело, мы делали.
Were there any fatalities? Yes, there were. I'm very sorry. It happened during transportation. We didn't know what to expect. If I'm not mistaken, the patient was 35 years old. We talked to him calmly. He was in an elevated position. When we accepted him, the saturation was 70. We raised it to 90. We didn't expect the heart arrest. When we arrived at the emergency room of the cardiac surgery, and the patient's heart stopped immediately. We started resuscitation, cardiopulmonary resuscitation. Every time you see death like that, it's hard. It takes a long time to recover. But that's our job.
Наши сотрудники, вот, фельдшера, врачи, более стали относиться...
It seems that our staff, doctors and medical assistants, have matured. The pandemic has made them realize how responsible they are. They seem to be so young, but they are so strong when facing the disease, helping the patients. There were complicated cases. There were patients who had to be given oxygen. There were intubated patients. The doctors and young medical assistants worked properly.
Но среди них есть и молодые фельдшера, которые обслуживали достойно.
The work has changed for the better. The attitude became different. That is, before we did not value doctors, but with COVID, everyone has seen that doctors work hard. My colleagues who worked in the provisional center in the hospital spent there all the time. It became their home. There were also cases when colleagues have died from the virus.
И все-таки эта пандемия, наверное, дала людям...
However, this pandemic made people turn to the present and reminded them that they need to live properly. Communicate with each other, appreciate, respect.
правильно общаться.
and love each other, eat right, lead a good life.
Уважать друг друга.
The pandemic has shaken us up.
Питаться правильно, вести правильный образ жизни. Я думаю, пандемия как бы дала людям немножко, стряхнула нас.
The third wave of coronavirus in South Korea has become more dangerous than the previous two. The primary focus of the disease is the capital city of Seoul, where strict quarantine measures have been imposed. My colleague Vladislav Tsoy will tell us about these measures. Vlad, hello. What is the current situation with coronavirus in South Korea, in Seoul in particular?
В Южной Корее сейчас идет третья волна коронавируса.
Now in South Korea, they are experiencing the third wave of coronavirus. The first wave started last spring, the second wave was in autumn, and now there's the third wave. It's fading thanks to the strict measures of the authorities. Before that, there were no such measures. For example, one of these measures is to gather no more than 4 people. 5 people can go somewhere together, to a restaurant for example, provided they are from the same family. If more than 4 people gather and they are not from the same family, the fine will be 100,000 won. That's about $90. Cafes and restaurants are open until 9 p.m. More than 4 people cannot sit at one table unless they are a family.
Больше 4 человек, если это не семья. Ну, естественно, маски, это у нас как положено еще при первой волне.
Naturally, we wear masks both indoors and outdoors. They imposed them during the first wave. They made an exception only for those who can't breathe. They have some breathing problems. These people may not wear a mask, and children are also allowed not to wear masks. The fine for not wearing a mask is 100,000 won, $90.
Сейчас нынешняя третья волна, она чем опасна, потому что это опять-таки очень
The current wave is dangerous. As for the first wave, it was in a small town of Daegu, which is the size of a regional center compared to Kazakhstan cities, and now the third wave is in Seoul and Gyeonggi province, which is like Nur-Sultan and Akmola region.
И провинция Гyeonggi это как Акмолинская область, как Нур-Султан и Акмолинская область. В Южной Корее 51,5 миллиона человек, из них где-то 20.
There are 51.5 people in South Korea, and 20 million of them live in Seoul and Gyeonggi province. It's very difficult to track so many people. Now, all those who come to Korea have to be under a 14-day quarantine. If you violate this quarantine, you get a fine and you can be expelled from the country. There have been many such cases where people were expelled. I don't remember that citizens of Kazakhstan were expelled, but there were cases when citizens of other countries were expelled from Korea. During the first and second waves, there wasn't such a rush because the first wave was in a small town. In Daegu, there was a rush. There were not enough beds in hospitals. They had to accommodate patients with COVID to the detriment of other patients. Now the same thing is happening in Seoul. There are not enough beds. They have even started setting up field hospitals because there aren't enough beds in the hospitals. Now they say that if you have a minor illness, if you don't need urgent intervention, you shouldn't go to hospital because there aren't enough beds.
Если там не нужно срочное какое-то вмешательство, то не обращайтесь в больницу, потому что не хватает мест. Вакцина ожидается.
There's no vaccine yet. The vaccine is expected in the second half of this year. They are not in a hurry to vaccinate people. They want to see how the vaccine performs, because there is news from abroad, from the United States, that the vaccine has side effects and is not suitable for everyone. Vlad, thank you very much for the interview. Take care.